Okay, thank you guys for joining me. I have Susan Gutjahr, who's the HIT director. I have Peter Hertzing, who is the clinical director for Sparta Community Hospital. Thank you guys for joining. Question for you guys. Obviously, you made the decision to buy a population health management technology platform. What were some of the main factors that drove your decision?
Well, frankly, the biggest factor driving many decisions in healthcare today do revolve around reimbursement. And as a critical access hospital that's operating a group of rural health clinics, we absolutely know that the top of our reimbursement is limited. Provider-based rural health clinics now have got a maximum reimbursement that just increases by, a little less than 3% a year. Critical access hospitals are now receiving about 90% of their cost for providing services through the Medicare program. So we have no choice but to make sure that we do everything in our power to capitalize on the opportunities to receive dollars and can pay for performance. And so population health is about improving the health of your community and making sure that you're getting paid for the performance that you are doing in improving that health. And so population health platform that allows us to both measure as well as see where our gaps are is essential in guiding our organization forward and ensuring that reimbursement is available to us.
And even though we've been on our EMR forever and are very familiar with it, we still can't get all the data out of it we needed.
Right.
And so we needed a platform and a vendor that was going to assist us. In looking at many of the top population health vendors out there, it came down to cost. It came down to a familiarity with our EMR,
Right.
which was very beneficial. And then just the relationship that we could grow with i2i. And that has been very positive.
Excellent. Tell me just a few values that you guys have gotten out of, because I know we've been up and running now for
Over a year,
which is great. So, what are some of the benefits that you've seen in this last 12 months?
Well, I think the biggest benefit for everybody is the ease of accessing information. Susan shared that we've been on our EMR for many years, and in that time, many different ideations of where data is put, where data is stored. And when you look at population health, what's so important is to be able to identify where any given patient stands at any given moment when they present for services. Are they behind on this lab testing? Are they behind on getting their colonoscopies done? When was the last time they had a complete wellness visit? And partnering with i2i, we are able to very quickly, through the patient visit summary system, identify where patients stand with all of those things that are important to us. And we're able to customize that summary to focus on the things that are providing us with the highest dollars in terms of reimbursement for our pay for performance, as well as those items that we feel are the most important for overall population health and improving patient quality of life.
And we've also, for many departments, but quality specifically, have been able to gather data, run reports on things that they have been manually auditing for years.
Right.
And so we recently even educated our EMR steering committee on what we could get out of i2i and how we could map data. And so we've begun to get some requests from other departments now that we've been in this a little bit, so that they can more easily have access to data that's going to help them make decisions in the business for the best of the patient, the best of the organization.
Awesome.
The one thing we know is i2i is just bringing us data that we already have. But we were spending, 15 or 20 minutes either before each visit or during each visit with the patient going and looking for that data. And while that was valuable time in knowing where that patient stood, by using the patient visit summary, we get that data, almost instantaneously. So that 15 or 20 minutes can be spent making sure that the patient meets those requirements instead of looking to see where they stand with those requirements. So honestly, it's added efficiencies in the office. It's saved time for the staff. And frankly, in today's healthcare environment with the difficulty in recruiting staff, I don't think we could be where we are today if we'd not figured out how to consolidate a lot of that work.
And we have a provider who is just enamored with the patient visit summaries and is using them exactly how we want him to use them. Not only to know where the patient stands, but as a discussion tool with the patient.
Oh, that's great.
He goes in, he goes over it, he writes some things he might want the patient to know on it, and then he gives it to the patient and says, take a picture, put it in your phone, have it available no matter where you go. And
Wow.
It has been well received with his staff.
That's great. Thank you guys for taking time. Appreciate your partnership. Thank you.
Thank you.
Thank you. We're excited about where we're going with population health and think i2i is a big part of that for us in the future.
Great. Thank you.